My timeline with mental health started when I came to college, I would say.
My mental health was generally good for the majority of my life. Late into high school and once I got to NYU, I started experiencing kind of more symptoms of anxiety and depression.
My name is Shelby King. I'm from Atlanta, Georgia, but I moved around a lot as a kid. I came to NYU actually for volleyball. As I was playing volleyball, I realized that I had really bad anxiety, and the volleyball team actually forced me to go see a psychologist.
My name is Kennedy McDonald. I'm from Mobile, Alabama. I'm 20 years old and I'm a student at Gallatin. In my observation, me and some of my friends that I've talked to did definitely experience an increase in anxiety and depressive-like symptoms upon arriving in New York. I feel like the city's very individualistic, and I don't know if that's necessarily conducive to good mental health.
You know, in my practice, and I know colleagues have also, seen a lot of people coming in around kind of big transitional points. So for example, going from high school to college is a very large transitional point. And sometimes people will come in experiencing anxiety or depressive symptoms that are more directly related to a life transition or adjustment issue. And that's a little bit different than, they could also have major depressive disorder, but sometimes it's not as severe as that, and it's more related, like I said, to the life transitional issues.
So a psychologist said I have depression before in the past. I was prescribed medication, which I no longer take. I no longer take my medication because I didn't feel like me when I was taking them. Anxiety really was an issue that came in waves, and so taking medication for it every day just, again, started to make me feel less like a person.
Late in my high school career, I was prescribed Adderall and for ADHD, and while that was initially good for my ADHD, it kind of exacerbated some of the symptoms of anxiety and depression when I wasn't on it. I have never been professionally treated for depression and anxiety, particularly because, having been prescribed the Adderall, a bit skeptical of the traditional methods of treatment nowadays. I don't want to be put on any more medicine or anything like that.
This comes up a lot where people have a lot of misconceptions about how frequently medication is prescribed or recommended, and also the impact of taking medication. And I remember a psychiatrist saying to me that, if you're a robot on a medication, then you're really not on the right medication. I guess I would want people to know that just coming into therapy doesn't mean you're automatically put on medication.
Depression and anxiety have affected my day-to-day life by suppressing my motivation. I still have a tendency to deny my disorders and do what's worse for me. Drinking especially is something that I know a lot of people with depression and anxiety tend to turn towards, and I have a really bad problem of turning towards drugs and alcohol when I start to feel depressed or anxious.
If I get too anxious, it's like a trip switch. And I feel like I have so much to do that I just fall into a depression, and then I don't want to get out of bed or do anything because I'm too anxious, and so it definitely makes me less productive.
For depression and anxiety included, you're always asking about impairment in functioning, meaning how much do these symptoms interfere with somebody's ability to function in their day-to-day life? Because obviously, we all sometimes feel anxious, or we all sometimes feel down and sad. Doesn't necessarily mean that you need treatment. And so we want to be thinking about, again, how frequently you're feeling these things and how much they're getting in the way for you.
The overexposure to social media and media in general has, for me personally, and for some people that I'm close to, severely exacerbated anxiety.
I think one of the big variables in like teens and young adults that maybe wasn't present like 30 years ago is obviously the presence of social media and the impact that can have on mental health. And also just the impact that can have on perceptions about how one should live their life. And so a lot of times it's helping people to recognize that social media is sometimes not, well, oftentimes not an accurate reflection of reality. As cheesy as it sounds, I would say like you're not alone. I think that there's many New Yorkers and just people in the country who are experiencing these things, and that you don't have to be very severe to come into therapy. I think sometimes we have this image in our mind of what a mental health patient looks like, and it's not really necessarily reality. I mean, I think people who come for treatment are like myself or anybody really who just wants to feel like a little bit better about their life.